This
Started.
conference will now be recorded.
Thank you for recording. This is Kristen Poppleton, and I am your host today. And I'd love to invite any announcements that people might have for the network before we go ahead with our presenter.
Hi, so this is Tamara Ledley. I sent out at the beginning of last week the link with some background information for the survey that I would greatly like input from classroom teachers on how they fund their professional development. The idea is trying to see how we can leverage multiple lines of revenue to fund educational efforts. So I sent it out to the network, and I asked many of you to forward it on to your networks of teachers. I would appreciate your doing that. And if you lost that email, I'm happy to send it to you again. So just let me know. I also posted it on the CLE Network Facebook page and have posted it on some other Facebook pages for relevant organizations. So hopefully we'll get a lot of input.
Great, thanks. Does anyone else have any announcements?
Sure, Jim Callahan. Let's see, coming off of now that we're getting close to the global climate strike events, as people know, we had this giant event on Sunday that was in part to promote that. What I want to announce is this is actually turning into kind of, it's almost kind of ironic that here we have a climate strike and the question of its schools, but it had a lot of organizations that are working on it come to appreciate the value of climate education more than they had. We work with a lot of programs, I'm sure a lot of other folks do, like 350, the various 350 orgs, who tend to reach out for adults as adults. Maybe they have kids, maybe they don't, but they're adults with adults. Well, they were wanting to reach over to have students, right? We wanted to have younger students come over too, and they didn't know how to do that. And they saw that educators know how to get a giant crowd of students to come over. There may be 100,000 students walking by, but if they don't come over to your booth, you're not really connecting with them. And what they learned is, yeah, one of the ways that you draw students over is have science experiments. Kids love science experiments. So it was big crowds. It was very successful and a lot. We just want to get that one of, there's an interesting thing for all of us of climate education in these climate strikes. Hey, you want to reach students, you gotta have stuff that people want to do, right? They want to connect. Anyway, just sharing that.
Great, thanks, Jim. And actually, to follow up on that, for those of you that are able to share or interested, we did develop a global strike resource guide for teachers. Our organization, Climate Generation, did, but then a greater coalition did. So the link to ours is in that one, and I'm going to put the link to the higher arching one right now. And it's regardless of if you or teachers around you are striking, this is a really great, tangible moment for teachers to talk to their kids about what is the ask of these strikers? What are they asking for? What is climate change? Why are they worried about it? Seizing these teachable moments are what we need to be doing. And so that is a great resource guide for folks that haven't seen it already. And if you could share it out in your networks, we'd love it. And the climate strike is happening next Friday. I get a sense it's going to be really huge. This time round, it has been really focused on young people, and young people have invited adults to join as allies in that space. And so there should be, I think, some big turnouts. There's people leaving work to attend it and support it, and so I would follow from there. A lot of organizations are doing good work around that. And so if you're interested, check that toolkit out. And I think that's all I have to say right now. Does anyone else have any announcements before we go on?
This is Frank at NOAA. Building on that, I wanted to alert you. I was talking with Laura Wineland from the Omega Institute for the Omega Center for Sustainable Living. She's the lead for the Drawdown Learn conference in Rhinebeck, New York. It's going to be happening October 18th to 20th. I put a link in there, she let me know that there are some more spots. She's going to send out an announcement to the Clean Network soon, but if you are thinking about registering and attending and participating, there's a lot of great sessions, and it's a really powerful solutions-focused education climate event. So just something to track if you have the ability and are in the area. So anyway, just something to think about.
Thank you.
Welcome.
Great. All right, well, if there's no one else, I'd love to introduce Brittany Shea, who's coming us today. She's the project director for the Global Consortium on Climate and Health Education, and she's going to be discussing with us their history, purpose, and offerings, including a virtual town square, an online knowledge bank, and core competencies and climate and health. And so with that, Brittany, you are welcome to take it over, and we will listen.
Great. Well, thank you so much. And can you hear me okay?
Yes.
Yep.
Okay, great. If you can't, just let me know if at any point I cut out. But thank you so much for having me, and I really appreciate this opportunity because we've known about the Clean Network for a while. We've heard such great things. We first learned about it from Dana Hain, who is one of our coordinating committee members, and she recommended that we reach out to you a while ago. So it's great to finally have this opportunity to talk with you guys. And so today I'm going to talk about climate and health education for health profession schools. And that includes nursing, schools of nursing, medicine, public health, etc. So let's see if I can move to the next. Okay, there we go. All right, so so first I'm going to talk about the rationale for climate and health education, which I imagine many on this call are familiar with. Okay, I'm not sure what that was, but I'm going to continue. Okay, so so the health impacts of climate change are numerous and they're serious, and they're predicted to intensify in the future. So, and there's an imperative for quick action on many fronts to recognize and respond to climate health threats, prevent climate change at its source by reducing heat trapping greenhouse gas emissions, support greener systems throughout the economy, including healthcare, and understand health co-benefits of adaptation and mitigation, and then also communicate effectively about these issues. So what is the role of health professionals in all of this? Well, climate change is impacting health, like we said, and health professionals need preparation for what they will need to handle. So that includes impacts of extreme heat, waterborne diseases, vector-borne and zoonotic diseases, mental health, degraded air quality from fires and warm temperatures, food security, safety and nutrition, and vulnerable populations, and more. However, there's a knowledge gap. The climate and health field is still young, and there's a modest number of experts, significant gaps in knowledge, and few developed educational programs or curricula in health profession schools. George Mason University actually published several surveys of physicians' perceptions of climate change. A large majority concluded that climate change is happening, is driven by human activity, and is relevant to patient care. A majority were already observing health impacts of climate change among their patients, and most commonly as increases in chronic disease severity from air pollution, allergic symptoms from exposure to plants or mold, and severe weather injuries. And they conducted another survey in 2016, which also cited significant barriers to physicians engaging on this issue. And that includes a lack of time, a lack of certainty about how to communicate it, and a lack of resources and recommendations for patients. So health professionals are critical groups to be educated, not only because of the health threats of climate change, but also because they're one of the most accessed and trusted sources of information about climate and health. So really important population that we're working with here. And so to bridge this gap, we must provide the next generation of global health leaders with the knowledge and tools to help protect human health and well-being from climate change and other planetary changes. So the GCCHE has identified 4 levels of interventions. So at the public health, for public health, the population level interventions for prevention and mitigation. The second is health systems, preparation for climate-related health events and decreasing carbon footprint. Third is clinical care for climate-related health impacts. And then the fourth is science to advance knowledge. So I'll now talk about the Global Consortium on Climate and Health Education, which is where I'm the project director, and we have kind of the secretariat here at the Columbia University Mailman School of Public Health. That's where we're based. And the GCCHE, which is what we call it, it was formed to help bridge the gap in knowledge on climate and health among health professionals. And the GCCHE is the virtual town square for climate health education. And right there, you can see our URL, which is gcche.mailman.columbia.edu. And that is where our virtual town square is based. So our vision and aims. Our vision is for all health professionals to be trained to prevent, mitigate, and respond to the health impacts of climate change. And our aims are to obtain commitments from health profession schools around the world to educate their students on health impacts of climate change and other planetary changes, to bring together these member institutions to share best scientific and educational practices, develop global standards for knowledge and practice on the health impacts of climate change that all graduates of health profession schools should possess, and share resources that these schools can use for the purpose, and build a pipeline of health professionals who focus their work on the health impacts of climate change, as well as support the development of global academic partnerships to foster mutual learning, and particularly in under-resourced countries. So the GCCHE has an interesting background, so that I wanted to tell you a bit about. And so we leverage the expertise of the Columbia Climate and Health Program. You can see a picture of them on the left there. That's some of our faculty, students, and staff. It was launched in 2008, and it was the first program of its kind in the US. And so it's really important that we have that, research and educational support here at the school. And the GCCHE was born from a meeting at the December 2015 United Nations 21st Climate Change Conference of the Parties, or COP21, in Paris, where the Mailman School partnered with the US White House on a special session to highlight the need for greater investment in the study of and planning for the health impacts of climate change. And this education was also recommended as an essential global action by the World Health Organization. And so a little bit about our structure. So we're supported with a global advisory council, which provides high-level strategic guidance and direction. And it's comprised of global leaders on health education, climate change, and community resilience. We also have an expert coordinating committee, which I mentioned briefly before, and this is experts in building climate resilience and climate health training. And they work closely with our leadership in advising on developing educational aims, crafting curricula, and carrying out other activities. And then lastly, we have our climate and health program science to education team. And so here we have a listing of our Global Advisory Council members. So Linda Freed, the Dean of the Mailman School, is the chair of the group. And then we have several other high-level people from industry, from the private sector, from international organizations, and from foundations. So it's a pretty diverse group there. And you can see these members on our website if you would like to find out more detail. Here are our coordinating committee members, and so you can see we have John Balvis there, who is from the NIEHS, and several people from academia. And again, if you'd like to see the listing, you can check out our website. And then here at the Mailman School, we have Dr. Jeff Shaman, who is the faculty lead for the consortium. We have Dr. Kim Knowlton, who's an external faculty advisor. She's at the Natural Resources Defense Council, and then myself. So to get into the activities and services, let me just see how much time we have left here. I just wanted to make sure that I'm not taking up too much time. I think we're okay. So activities and services.
You have the full hour. I mean, we'd like to have questions. Oh yeah, we'll have questions, sure, but yep.
Okay, great.
Yep, no worries.
So the GCCHE has several activities and services, not only for members. Some of our offerings are only for members, like our webinars and things like that. But a lot of our resources are freely available on our website for everyone to access. So we, like I mentioned, we're the virtual town square for health professions institutions to engage on climate health education. And it's a global network. So our membership is from all over the world. We have almost 200 members from almost 30 countries, representing institutions with an estimated 150,000 students on 6 continents. And this was one of our main goals, was to obtain commitments from the schools and programs to educate their students on climate and health. So members participate through periodic webinars, our interactive website, the Virtual Town Square, which provides resources and tools, and that includes model climate and health curricula, and as well as email communication and other methods for sharing strategies, challenges, and success stories for integrating climate and health. So our baseline survey was one of the first efforts that we did after the consortium launched in 2017. We wanted to establish a baseline to better understand the current assets and needs to enable institutions to implement their membership. And we have submitted the results of the survey to be published in a peer-reviewed journal, which we're trying to do right now. So just as a little intro to that data, so some preliminary results. We had about a 53% response rate, with 84 institutional responses collected out of 160. And out of 84 respondents, about 63% offer climate health education. And most frequently, it is as a session during a required core course, as a standalone elective, or a session during a non-required course. And so we created this knowledge bank of climate and health resources on the GCCHE website. And that was one of our goals, is we wanted to provide the resources for member institutions to implement their commitment. So this includes resources and tools for educators on climate and health. As I mentioned, it's freely available and open to the public. And we, in trying to figure out how to provide climate and health educational resources, we did a lot of discussing and strategizing around the best way to approach this. And we found that there's already so much content on climate and health that's out there, and we didn't want to reinvent the wheel. So we wanted to be the place where we bring all of these resources together in one location. And so the Knowledge Bank links to resources that are already publicly available online. So that includes slides, videos, and online courses. And these resources are indexed by impact area within a larger climate health teaching framework of core competencies, which I'll discuss in the next slide. And the indexing is designed to maximize the teaching resources utility for educators, and it can be adapted to institutions' local needs and priorities. And we also link to curricular guidance, information, and opportunities. And so here you can see that some examples of resources. So those developed by the NIEHS, which includes slides, case studies, and lesson plans for clinical care students. A paper that was published that discusses how and where content can be integrated into courses, in the bottom left by Caroline Wellberry et al. And then a textbook called Enviromedics. And another main goal for the GCCHE was to develop global standards for knowledge and practice on the health impacts of climate change that all graduates should possess. And so we have just begun efforts to promote climate and health in licensure exam questions and credentialing criteria for schools. And in addition to that, we have a set of core competencies on climate and health for all health professionals. And this was developed with the expertise of our coordinating committee and advisory council. And with those core competencies, we wanted to address the question of what students need to know on this topic. So the competencies are for all health professionals, including medicine, public health, and nursing, and there are 16 of them across 5 areas of practice. And this includes an understanding of complex environmental systems and methods for measuring their impact on human health, climate, and health, knowledge for the public health and clinical practice, and understanding of political and communication aspects. It also includes how students can be proactive in improving the environment through climate health activism and policy engagement, including promoting healthy and more sustainable behaviors in the clinical settings and reducing the carbon footprint of healthcare delivery. So if institutions want to add a few slides into existing courses, we put together, or if they want to put together a module, a course, or something like that, these competencies can be used as an outline of what to include, and the resources organized by topic can provide the content. So GCCHE also brings together member institutions to share strategies and best practices on how to integrate the content. So we hold member webinars, which provide opportunities for members to discuss strategies, challenges, and success stories. And we also gather and share ideas from our coordinating committee. So all of these strategies and methods for integrating content are important. So institutions can start with one thing, like getting some climate and health content into existing courses, and then they can develop a climate and health course offering. Then ultimately, climate health could be integrated throughout the entire academic program. So one strategy is infusion into existing courses. So if you add a few slides into each course, you can reach everyone. But another strategy for getting started is creating an elective. So this attracts people that are really interested in the topic and they can become champions. So one example is the climate medicine elective at the University of Colorado School of Medicine. Another thing that can be created are fellowships. And there's a new graduate medical education fellowship that was also started by the University of Colorado in climate and health science policy. So there's a paper that just came out about that. It's a really interesting concept. Another thing is projects for students on research and activism to do at institutions linked with incentives. So this can include student projects with professionals in the field to see how climate health information is used in practice. So students are really important to advancing climate and health. You can create climate champions at schools, students that are really interested in driving this forward and owning the topic. And then you can also have students get involved with different student associations that are working on this effort. So another thing that GCCHE is doing is broadening the reach of discussions about the importance of climate health education. So the consortium has been included in high-level educational guides, reports, and we've interacted with a range of groups. We've had presentations and published in journals and media outlets, the New York Times, Wall Street Journal, Lancet Countdown on Health and Climate Change Brief for the United States of America. And actually in the Lancet Countdown report for the US, they identified the education of health professionals as one of the top priorities for response by the healthcare sector. And it named the GCCHE as an example of an initiative working towards that effort. So after all of this that I mentioned, where are we going and what does success look like for us? So success is that climate and health content is integrated into all health profession schools and programs around the world. And some plans for where we'd like to go with additional funding is to expand membership even more internationally. We'd like to establish regional leadership councils and student practicum to develop recommendations for implementation on climate health education. We'd like to improve tracking progress of members on core competencies. We'd love to develop videos on topical events in climate and health, conduct more surveys, and create new opportunities for members to engage and interact. So that's all for my presentation. Thank you so much again for the opportunity. And you can visit the website that's listed there again if you want to find out more about articles and reports, conferences, and there's also the link there to join the consortium. So we're requesting sign-on from the head or the dean of the health profession school, so to sign on institutionally. So thank you so much.
Thank you. Does anyone have any questions for Brittany?
Brittany, this is Frank at NOAA. I've been following. I think I'm even a member of your consortium, and following the work carefully. But one of the things I'm wondering about in the core competencies, it's something that the clean community have spent a lot of time on for in the broader climate literacy space. But one of the things I didn't see in the competencies as I quickly went through it is when people are dealing with this issue, especially I would imagine health practitioners, that we've had many talks about this in clean networks like yours, about when you see how daunting the problem is, people tend to move to what are we going to do very rapidly, and the little solutions aren't cutting it. They want to really know what's going to make a difference. But being skillful in that exchange between problem and solution and effective solution, I would assume shows up in this work somewhere. As you had said at the beginning, that health practitioners are one of the frontline climate engagement professionals out there, like broadcast meteorologists. So does that at all trigger anything that's shown up in your conversations to date? And is that an area where we could collaborate as two communities who focus on these issues?
Yeah, so thank you so much for your question, Frank. It's nice to meet you over the internet. Is your question about whether we talk about solutions in the core competencies?
Well, it's about building the skill of the practitioners to building skills skillfully. You get my point. On how the practitioners navigate the tendency for people to want to come and talk about solutions. And I mean, this shows up in my work where I go in and talk with students, and they some of the questions they ask: is it too late? Are we all going to die? Is there hope? Is there still time? Those kinds of questions, a practitioner, whether an educator, a broadcast meteorologist, or a health practitioner, need to be able to skillfully navigate that space. And there's some competencies related to that. So I was wondering if that shows up, because it's kind of like area of practice 5, but it's a little different than what's in there currently.
Can I hop in quick too?
Because
I want to split up two of the things you said that I was thinking about too. So one, we had a doctor come to one of our community engagement institutes on how to talk about climate change, and she was talking about how she's trying to figure out how, as a doctor, when she has people come in who, for example, need more exercise, when it might be appropriate to actually say, like, well, if you walked instead of drove, and that would be good for your health, and it's good for the planet, and like how that sort of comes in. So there's like that piece. Have you thought of, do you drill down to those sorts of things? And then the other piece is the mental health piece, which I think you were kind of hinting at too, Frank, which is just like the profound impact that this crisis is having on depression, anxiety, and like how practitioners need to be prepared for dealing with that part too, and recognizing that that's part of the problem.
Yeah, so thanks for your question too. And yeah, mental health is a big concern, and it's a topic that has been brought up and in the news and written about a lot more recently. It's a really important topic, and there are a few organizations that are kind of focusing on this area. So to get to your questions about whether mental health and solutions and kind of like communication efforts are included in our resources, the answer is yes. So in the core competencies, mental health is one of the areas that we note as what the health impacts of climate change are. So if you look at the core competencies on the website, they're very detailed at this point. And mental health is mentioned in there in the core competencies, but it's also, there's a section in the knowledge bank with resources that are specific to mental health. So educators can go to the website and they can find some materials that might help them in integrating the topic into their curricula. And then with the solutions, we understand that that's a big thing. And so one of the, aside from just knowing about this information, it's also knowing how students can be proactive in taking this information and knowing how they can, get involved with more communications efforts or some policy project if it's of interest to them. and information on how to communicate effectively about these issues. So those are outlined in the core competencies as things that all health professionals should know. And then in our in the knowledge bank, we have, according to those competencies, resources that can be used. So does that help answer the question?
Yeah, I think I got something. Frank, how are you doing?
It feels in my practice that there's been a lot of, I mean, it's kind of not fair in some ways, because you're asking professionals to be able to answer things that are not their profession, but you happen to be the person who's in front of you, who has the problem space. So, you know what I mean? It's a vexing challenge. We at NOAA, our climate scientists are asked questions about what can we do to solve climate change all the time, and that's not their professional expertise. So it's a bit of a transdisciplinary challenge, where but how you skillfully breathe that together. I think there's an area for collaboration here in our community. I don't know what that looks like at this point in time. It's still emerging for us. But I think that's we've been exploring that for about 2 years now in different ways. But maybe there's a side conversation down the road where we could tee that up, because I think it's going to show up as a more pressing challenge for people as we move forward. So maybe we just put a pin in it for now. That's
Well,
okay with you.
Jim Callahan here. As usual, Frank, you are on. You bring up the essential things. I think there's a lot to it that actually fits that. For instance, here in California, we work a lot with Kaiser Permanente, right? Because Kaiser has not only because a lot of us belong to Kaiser and it's based here in Oakland and San Francisco, but Kaiser was often one of the corporations that would be kind of taking bragging rights that its buildings are more energy efficient, and it does a lot of things about climate change early on, like 2004 in that area. What I'm thinking of is that to run with the idea that so many of the things that health professionals want the public to do to stay healthy are the things you do to make things safer for climate change, like walking, like riding a bicycle, plant-based foods, have your buildings be efficient. And maybe another one is there's a reason why the hospitals, it's kind of easy for them to be leaders, or at least not dragging their feet on having energy efficient buildings and doing their work, is because they tend to own them for a long time, right? Businesses that build and then sell the buildings don't necessarily care about the efficiency, but the hospitals are looking at overall keeping their costs managed, and an efficient building is a good investment. So, I mean, there's a lot of times for health professionals and the corporations themselves that they're sort of they're easy on. I mean, it's not asking them to do the right thing, but it's against their bottom line. It's with their bottom line, and this their message. I would say we've seen a lot of that works pretty well in California. That to do that. Now, how the part that I don't know, I'm learning, is how is it done in different parts of the country when you're educating the doctors, the technicians, and the nurses themselves. I mean, I'm used to more like how Kaiser goes out to the public, which in turn also does the healthcare professionals. Like, are there conferences, or the symposium? Is it newsletters? I mean, how is the work you're doing then translate into how does that message get to the doctors? And is it through? Maybe one more question was: is it through, like, well, it'll be the Kaiser doctors, it'll be the doctors at this hospital or this HMO? I mean, is it tend to be broken up by the corporate entities?
Yeah, so basically our way of getting this information to health professionals is by educating them when they're in school. So that's our focus now. So there are, we have talked about continuing education and things like that, but at this point, our focus is students, so that are in schools of medicine, nursing, and public health and other health professions. So that's where our focus is, and then the hope is that they take this knowledge that's integrated into their curriculum and bring it into practice with them, so they had that knowledge there. So I definitely hear you about the, you know, is it the responsibility of health professionals to know this? And you know, we want health professionals to have this information so that they can then take the knowledge with them into whatever role they go into in the future, whether it's as a doctor or a public health professional or a nurse, so that they can take this knowledge and they know how to, if they would like to get more involved with policy engagement. They know how they understand the role of different policy frameworks in addressing health risks and things like this. They know how to communicate with patients, or they know how to communicate with the public. So does that answer your question a little bit?
Yeah, no, that your work is you're communicating through the medical schools, if that's too simplistic, but something along that line, right? That so I would put with it that some of what has happened where there are institutions that are already dealing with the professionals, the doctors and the nurses, there are things I'm sure you can pull from that. As you said, there's a lot of information out there that, so there people are not reinventing the wheel over what are the things that are working and other ways of communicating.
Yeah, so there are organizations that are working with professionals, like the Medical Society Consortium is working with professional medical associations, and I think they might have branched out to other health professions associations as well. But they're really about working with doctors and helping them to become advocates, and you know, they're going to Capitol Hill and they're talking to Congress people there about climate and health. So there are different groups working in different areas, and our focus really is right now on education for schools, for these professional schools. And so we provide the resources so that the schools can then take them and integrate them in a way that they can. So we're not being prescriptive about it. We're saying that these are the core competencies that, you know, everyone should have, but then they can take the information and integrate it in a way that makes sense for their school, because each institution is going to do it differently. So we provide opportunities like webinars, which I mentioned. So during the webinars, we have member schools present about how they have integrated the content into their school. So for example, Mount Sinai here in New York City, the medical school has, they're working on a climate infusion project where they are integrating climate and health content into multiple different courses. And they're infusing it. Instead of having a specific course on the topic, they found a way where it doesn't add significantly more time, because there's already a really packed curriculum, especially medical schools. So they're finding a way that, you know, they can make this sustainable. So they're doing really interesting work there, and they've worked with the GCCHE Core Competencies to help figure out what content to include. So that's just one example.
Hey, Brittany, this is Patrick.
Hi,
Thanks for your
Patrick.
presentation. Hey.
Thank you.
One reason I was excited to have you present to Clean was because I really admire the model that you guys have set up to reach a relatively large group of people relatively quickly. And I know sometimes as a community we discuss teaching the teachers, giving them the information they need to broaden their climate-focused lessons in the classrooms and the resources to do so. I was wondering if you could talk a little bit about how you set that system up, if you found that colleges were just ready to jump on board and, oh yeah, of course we should include that, you know, love to have that in there, or if it was more of a marketing effort Just a bit about how that system came together for y'all.
Yeah, that's a really good question. So we did, so as I mentioned, we started the idea for the GCCHE started after the COP21 conference in Paris. And so the Mailman School and the White House partnered on a session there. And they talked about how there needs to be greater investment in the study of climate and health. And at that session, there were, I think it was 115 or over, 115 or over health profession schools signed a pledge committing to educating their students on this topic. And that pledge was kind of carried forward by the Mailman School. And so after that session, the Mailman School decided to start this global consortium. And when that happened, they wanted to have, the consortium was really intended to help those schools that originally signed that pledge to implement the pledge. And so we didn't want to assume that those 115 schools that signed the pledge automatically were going to want to be in the consortium. So what we did, when we launched, is we reached out again to those 115 schools to invite them to join the consortium. And we sent invitations through our dean's office, actually. So the invitations came from a high level, from the dean of our school to the dean or head of the school or program that we were inviting to invite them. And then beyond that, we expanded to more schools and just continued from there. So we are continuing to invite people to join. And I think once you get a bunch on, it's more schools are kind of seeing that this is important and wanting to get involved. So sometimes we don't even reach out to schools; they'll contact us and say, how can we get involved? And we're finding that this is happening more now. So that just gives you a little idea. It was it did require work in the beginning to. And still does now to expand and get our word out there and marketing efforts, as you said. And then there's also the piece of people finding us online or hearing about us at a conference or a meeting. So it's a bit of both.
Great, thank you.
Thank you.
Brittany, this is Frank again. Just a quick thought. I noticed that you have AGU listed as one of your upcoming meetings. Can you speak about what sessions or talks or what you're doing there? Because we do a ton, and a lot of our membership are there. So it might be a good opportunity for us to deepen our understanding of each other's work.
Sorry, could you say that? What is the meeting again? Is this listed in upcoming event?
Yeah, the American Geophysical Union meeting in that one.
Okay. Yeah. So basically, that I think that's under one of our upcoming. Sorry, not one of our upcoming events, but that's under an upcoming event in climate and health. Right now, we don't have anything planned for the session, or sorry, for that meeting. The GCCHE doesn't, but I know that there are faculty that are from Columbia that might be involved with that meeting. It's just that the GCCHE itself doesn't have anything set up. So basically that part of the website is like upcoming events in climate and health or climate and health education that people might be interested, that our members might be interested in attending.
Gotcha. I gotcha.
But what do you, so tell me a little bit more about what you guys have planned there.
Well, we historically, I don't know how many years we've been doing this, but a lot of we have proposed sessions, and then we coordinate those on climate literacy, mostly in the education thread section, I guess it is. And then we coordinate a lot of the talks and sessions and proposals and coordinate some of the collaborations. And then we do at the meeting, I can't remember how many talks are, Katie, do you know how many talks were actually accepted this year?
Not off the top of my head.
But it's a sizable number. So we've kind of built a conference inside of the AGU for many, many years. It's smaller than it used to be because there's less funding.
It's been going on since 2011.
Thank you, Tamara. I knew you might know that. So, but it also affords us the opportunity to have side meetings and network opportunities. You know, giving the talks is only part of the equation. There's a lot of other work that happens there, and so we've chosen AGU as one of our major events of the year where we focus and collaborate and share and you know, network on climate and energy literacy.
That's great. That sounds really, really interesting.
Yes.
Great.
Also, for whatever it's worth, UCSF Medical School is about 4 miles from there. So if there's any tie-in between them, that's you know, looking at the medical schools across the United States, you know, it makes sense to where we have strength all in the same place that we can help each other. But so one of the major medical schools is 4 miles from there, so, from AGU, for where it's going to be held.
Great.
Maybe
Does
also,
anyone else have any questions? None at all. All right. Great. Well, I think we can close things up then, right? Even though we're 8 minutes early.
Hey, Kristen, it's Reb. Can I?
Oh, hey, Reb.
Hi everyone. Sorry I'm joining so late, but were you able to talk at all about the educator resource guide for the upcoming climate strike, or can I share that link out?
Yeah, I did. It's in the, I shared it out and I talked about it, but you can talk about it more. It's in the chat.
No, perfect. That's awesome. Thank you.
Yep. Cool. All right. Well, thanks everyone. Have a great week.
Thanks so much.
Thank you, Brittany.
Thank you. Bye-bye.
Right.